Hi, my name is Dr. Christopher Blue. I'm a family physician from Windsor, Ontario, and I also practice cannabinoid medicine on a regular basis. Today I'm going to be talking to you about dosing and titration of cannabis. Currently the dosing is based on THC and CBD. In the past we used to dose based on weight of the flower. However, now the shift is focusing actually on milligram dosing of THC and CBD. So dosing does not include other cannabinoids involved in whole plant cannabis, nor does it include terpenes and flavonoids. But dosing can also be affected by routes of administration. The current recommendation is always start low and go slow. And we also need to determine whether we're going to be inhaling the cannabis or ingesting the cannabis. Realistically, when we're starting with ingestion of cannabis, if we're dealing with THC, the recommended guidelines are to start at 1.25 milligrams to 2 milligrams per day for the first 1 to 2 days. On day 3 and day 4, increase your dose by 1.25 increments. And you will be doing that every 2 to 3 days until you reach the desired effect. Obviously, if we go too high with the dose, certainly back down to the previous dose. For daytime dosing of THC, the same recommendation of start low and go slow is imperative, because if we're going to be consuming THC throughout the day, it certainly can impair your judgment, and we need to stay on the lower doses so that we're not impaired if we need to be out and about in society. Similar to nighttime dosing, we would start with 1.25 milligrams to 2 milligrams and increase slowly. Realistically, looking for nothing more than 5 milligrams throughout the day. Certainly, if you're going to be exceeding more than 20 milligrams of THC throughout the day, this is a significantly high dose and certainly increases side effect risk and can certainly impair judgment. With CBD dosing, it's a little bit simpler because it does not impair your judgment. There is really no established dosing guidelines. There's no maximum dose established when dealing with THC. Dosing variability can be based on certain conditions, whether we're dealing with inflammation, depression, seizure disorders, or cancers. However, when dealing with CBD dosing, me personally and some of the recommendations are to go in 10 milligram increments. And so you would start at 10 milligrams of CBD for 1 to 2 days and then increase it in 10 milligram increments every 2 to 3 days thereafter. However, depending on, again, on the condition, if we're dealing, for instance, with a drug-resistant seizure disorder, sometimes the dosing can get as high as 25 to 50 milligrams per kilogram per day. This also certainly can be divided up into several doses throughout the day as well. The route of administration of cannabis can also affect the onset and duration of the cannabis. If we're going to be inhaling cannabis, it can set in anywhere from 5 to 10 minutes, but it's short-lived. It only lasts anywhere from 2 to 4 hours. If we're going to be ingesting cannabis, either in an edible form or an oil preparation, it can take anywhere from 1 hour to 2 hours to initiate effect, but can last a lot longer, in anywhere from 6 to 8 hours. If we're doing sublingual administration, it can take effect in anywhere from 15 to 45 minutes and will last a long time as well, upwards to 6 to 8 hours. And topical administration of cannabis can be variable. It's also can only be variable to the site of application, or it can also have a systemic effect based on the concentration of the topical cannabis you apply. Thank you. This concludes my presentation on dosing and titration of medical cannabis.